Welcome to this week's NIB News Update.
It was all fireworks and celebration recently at the Friendly Pharmacy at Elizabeth, where the National Prescription Drug Plan celebrated its first anniversary. A year has passed since certain groups who are afflicted with chronic diseases have been assisted by the NIB-sponsored plan. Drug Plan Manager Tammy Francis tells us the status of the National Prescription Drug Plan 1 year later.
The drug plan opened its doors exactly 1 year ago on September 20th. We started with 4 groups, which included the NIB pensioners, NIB invalids, Bahamian citizens 65 and over, children under the age of 18 and under 25 if they are full-time students. Since the inception of the drug plan, we have grown tremendously. We started with 6,500 beneficiaries, and we are now at, I'm happy to say, 16,000 beneficiaries. The drug plan provides medication for 11 chronic conditions to its eligible members. Members are able to use their ACE prescription card at any participating pharmacy. At present, we have approximately 110 participating pharmacies, of which 40 of these are private pharmacies and 10 of which are private pharmacies in the Family Islands. To date, we would have paid over 120,000 claims and it would have paid out approximately $2.1 million. The drug plan not only focuses on treatment of chronic conditions, but we also focus on reducing the prevalence of the chronic conditions through initiation of our Healthy People program about 7 months ago. And we kicked off with our pilot program, the Get Well Bahamas Challenge. The Get Well Bahamas Challenge was geared towards 40 individuals being afforded the opportunity of 12 weeks of personal wellness coaching and professional fitness training geared towards healthier lifestyles and behavior modification.
Drug Plan Manager Francis tells us what to expect from the plan going forward.
The next step for the National Prescription Drug Plan is to include the entire Bahamas so that they can enjoy the benefits that the current 16,000 beneficiaries are now receiving. On behalf of the National Prescription Drug Plan, I would like to say thank you to our beneficiaries, our pharmacies, wholesalers, and physicians for the continued support over this past year.
Chief Pharmacist Brenna Brown Turnquest tells us about the drug plan from her perspective.
We started off the year with very few people actually bringing their cards and accessing the plan. We had a few hiccups the first week, which we quickly smoothed out. And as we have progressed throughout the year, each week we have seen growth. We have seen new people coming in to register. Registration just really hasn't stopped. We had the prescriptions being filled just increase and increase to now we fill about 16,000 prescriptions per month under the drug plan. We have had some challenges. We've had persons who didn't know to register with all of their diseases, but we've been seeing that improve over the course of the year. We actually now even have the pharmacists to where they recognize when a person comes in and their medication is not approved because they're not diagnosed with the disease. And they inform the patient that they have registration forms that they keep in the pharmacies now to help assist patients with registering with the plan. One of the challenges we still have are with children. We want children to register. We do cover medications for arthritis. We cover for juvenile arthritis. We cover for asthma. We cover for diabetes. So any child that has any of these diseases, we do encourage them to continue to come and register. But overall, the growth of the plan has been tremendous.
With one successful year of the National Prescription Drug Plan behind, the Bahamian public can only look to good things to come. Reducing costs, increasing access, improving health.